Okay. We're going to go over the CBO for open and closed suction for the neonatal rotation. We will go over a bit of background knowledge and what is expected of us as students to successfully complete the CBO. Suctioning should never be done on routine. Suctioning should only be done as needed. There are many hazards that can result from unnecessary suctioning, such as mucosal damage, hypoxemia from sucking the air out of the lungs, atelectasis from applying negative pressure to the lungs, arrhythmias, hyper or hypotension, increased ICP, infection, and bronchospasm. The suction levels for the neonatal population for open suction should be set at -50 to -80 millimeters of mercury, which it is set at now. For closed suction, we want to increase the suction pressure by 10 millimeters of mercury. So if we had it set on -80 for open suction, we would change it to -90 for closed suction. To select the suction catheter size, we can use the formula ETT inner diameter times 3 divided by 2, or we can use the formula ETT inner diameter times 1.5. They'll both give the same answer. So step 1 is assessment. The patient should be assessed to determine if they need suctioning. Signs that the patient needs to be suctioned include visible secretions in the upper airway or the tube, coarse crackles on auscultation, or deteriorating blood gases. In pressure-oriented ventilation, you will notice the tidal volumes drop with increased secretions. In volume-oriented ventilation, you will notice increased peak inspiratory pressures with increased secretions. So step 2 is to assemble the appropriate equipment. So you want to have your suction catheter open and attached to the suction, ready to go. Have your suction ready, set on regulated, and turn to the appropriate suction level. Your suction tubing, and you'll have a collection bottle also on here. And for open suction, you'll have to use a sterile glove for handling the catheter, and your other hand will have a glove on it, but it will be clean. Step 3 is pre-oxygenation. So on the Servo-I, it has a feature called suction support, which makes it really easy to suction. So you go to quick access, suction support, and for the neonatal population, you want to increase your FiO2 by 10 to 20%. So if they were set on 50 before, you would change it to 60 for pre-oxygenation. So hit accept, and now it will give 120 seconds of that selected FiO2, which was 60%. When you disconnect the baby from the ventilator will go to standby. And at this point you can suction the baby, and when you're done you reconnect, and now the ventilator automatically goes into post-oxygenation or re-oxygenation, and it goes to that same FiO2 that you set, and it'll give it for 60 seconds. If that 60 seconds runs out and you're still on that increased FiO2, it will go back to the original FiO2 you had set. So at this point we're just going to cancel that. Okay. So when you go to insert the catheter, you want to make sure that you're going to the correct depth. In a baby, what you want to do is insert the catheter to the end of the endotracheal tube, not until you feel resistance. So to calculate that, for open suction, you will use the formula length of the ETT plus 3 centimeters. The plus 3 centimeters is for the blue connector on the ETT. 3 centimeters is from the tip to the other tip. So on this one it would be about 6.5 plus 3 centimeters for suctioning depth. In closed suction, you use length of the ETT plus 5 centimeters for the closed suctioning adapter, which is a little bit longer. When you're applying the suction, it should only take 5 to 10 seconds to withdraw. And while you're suctioning, you want to position yourself so that you can see the monitor easily, and if any adverse effects occur, you should stop suctioning right away. So after you're done suctioning, you should reassess the patient. You just want to do a basic ABC, make sure you auscultate, and you can only use the same open suction catheter 3 times. After 3 times, you should change it. And then to finish up, you just want to clean up and document. So you'll wrap the catheter inside your glove, and we'll demonstrate that after. And you want to document what you saw when you suctioned. So you want to document things like amount of sputum, color, thickness, and the amount of times the patient was suctioned.